Hello and welcome. I'm Rachel Hall of Evolved Dental Healing. I'm a holistic dentist and welcome to my live show called Exposed Teeth. I'm going to be talking over the next few weeks and months about what I know about dentistry, expose some of the myths and mistruths, and also debunk things that people think are true. I'm the founder and principal dentist of Evolved Dental Healing. I've got over 26 years experience and I've been practicing holistically since 2001. Now, I'm going to tell you I'm not your typical dentist. I like to be a bit of an opinion leader. I like to challenge convention and I want to empower people to make better dental and health choices. And we've helped thousands of people over the years have natural, healthy smiles. I'm a writer and a presenter on holistic dentistry, health and wellness, and really it's my mission to revolutionise the way people see their dental health. And this is why I'm doing the live show. So if you're watching live, I want to say thank you very much for taking the time. If you're watching the replay, that's awesome that you're taking the time to invest in yourself. This is a live show. I want you to participate. So if you're watching, say hello, say where you're from. Feel free to ask questions because I'd like to do a bit of a Q&A if you want. So here we go. So exposed teeth. What I want to talk about today is a little bit about who I am for those of you who have not watched me before, and a little bit behind what the philosophies are on dental holistic dentistry and how that varies from what you get at your traditional dentist. Well, one of the things that I pride myself on here at Evolved Dental is being very comprehensive, covering all the bases and not just looking at your teeth, but looking at your bite, your jaw joint function, looking for any health issues or abnormalities that your mouth can show, looking at how you breathe, how your chewing function, your gum health and your teeth and what materials are in them. We also cover nutrition, stress and lifestyle and environmental factors because we believe that if we look at the whole person, we're going to get the answers to the dental problems. So you might go, well, you know, there's hundreds of dentists out there. There might be several in your area. I mean, like here in Kenmore, where I work, there's probably about 10 dentists. We're really overloaded. And each dentist is essentially going to work in a very similar fashion. But we're all going to have slightly differing approaches and philosophies when it comes to our style of dentistry and what we're going to recommend and what we feel is the best treatment. But one of the biggest differences in our philosophy occurs between traditional dentistry and holistic dentists. Now, the word holistic is not really a reflection of any of the practices or techniques that we use because dentistry is dentistry at the end of the day. If there's decay, we have to remove it and then repair the tooth. If there's infection, we have to treat it and so on. But it's the overall philosophy of the role of oral health and oral care on our health and well-being where we can differ. So a truly holistic dentist is going to want to educate their patients on the importance of overall health and how dentistry can play a role in well-being. So our aim is to perform dentistry that's good for the body as well as the teeth and gums. So my philosophies might be a little bit different to the dentist who's just round the corner, but my techniques and methods that I provide are to some degree the same. So what are my philosophies? How do they differ to mainstream dentistry? Well, I believe that what goes in your mouth has an effect on your entire body, and therefore we want to use filling materials that are good for you. So we're going to use different materials for root canals and crowns and bridge work that a traditional dentist might. We like to be metal free and ensure that those materials have been tested for safety, toxicity, allergic reactions. We want to make sure they don't have harsh chemicals in or any toxins that are going to impact on your well-being. I also believe that how you are with your body, your lifestyle, your stress levels, your nutrition, etc. will affect your teeth and gums, and I understand the impact of lifestyle, diet and illness and disease on your oral health. So because I choose a holistic approach, I'm not going to use amalgam mercury fillings. I'm not going to advocate the ingestion of fluoride, which is essentially poisonous when we ingest it and it accumulates in the body, as does mercury that can leak out of your silver fillings. Now, when I'm working on teeth and I'm having to drill out silver fillings, because of that mercury content, I understand the importance of adhering to strict protocols to ensure that my patients, my dental team, myself, and also the environment are not getting inadvertently exposed to mercury that gets released during our treatment procedures. So, as I said, I'm also going to aim to educate and empower my patients to make the best lifestyle choices, not only for their dental and oral health, but their overall well-being as well. So, what do these philosophies look like? And how do they differ? And what do we apply in our general day-to-day practice? So, if you've just joined, I'm Dr. Rachel. This is my show called Exposed Teeth. I'm talking about some of the facts and myths and issues around dental health and how that impacts on your health. I'm here to get to the heart of things, to drill down into what's really going on with your dental health, pardon the pun. So if you're here live, thank you very much. Do say hello. Take time to let us know where you're from in the chat, and feel free to ask questions. Now, I'm going to be running this show every Tuesday night, every other week at 5:30 p.m. Queensland time, which at the moment is 6:30 p.m. Sydney time, and I'll let you work out your time zones. Look out for the notifications on our Facebook feed and you won't miss out. You can also watch the replay later because it will be posted on the page. So, talking about the philosophies of holistic dentistry and what those holistic philosophies look like in what I do day to day in general practice. Well, as I said, I don't use mercury fillings because even though traditional dentistry advocates that mercury is safe, they're long-lasting because they use them because they're long-lasting, they're hard-wearing. I'm deeply concerned about the high content of mercury in those fillings. There's been a lot of research that shows that mercury does leak out and that it tracks to different organs within the body, particularly the brain, where it can damage your brain fibres, causing them to shrink and almost short circuit. So mercury is a toxin in even small amounts. So it presents a risk to your body and your overall health. So I choose not to use amalgam. And as I said, I follow those strict guidelines. I'm SMART certified, which means that we do safe mercury amalgam removal technique, and we use essential protocols and safety equipment to look after you when we remove those fillings. Now, there's a difference of opinion within holistic dentistry even over certain treatments and therapies. And one of these differences comes when we talk about root canal therapy, for example. Now, root canal therapy is recommended as a technique to be able to save a tooth that has suffered severe decay or trauma and the tooth has died or is beginning to die. Because if we leave it as it is, it's going to become infected, it's going to get abscessed, and then that infection can spread and cause its own problems. Now, root canal is seen as a technique that has been proven safe and effective, and it's a means of keeping your natural tooth rather than the alternative, which is having it extracted and then having a false tooth or an implant to replace it. However, many holistic dentists do not typically recommend or perform root canal, as there are some studies that seem to lean towards saying that it's impossible to completely sterilise the canal, remove all the bacteria, and stop there being any adverse effects. And there's also concerns that some of the chemicals that are used to disinfect or sterilise inside the canal can be toxic, as can some of the materials. Well, for me, the jury is still out on this subject. And whilst I don't actually personally perform root canal treatment, we do still recommend it and we refer to specialists. And I think at the end of the day, that comes down to the patient's personal choice, their health, the condition of the tooth, and whether it's worth or it's possible to save it. So there are materials that are more biocompatible and less toxic. We can use lasers and ozone to treat inside the tooth. So it'd be interesting to see where the research goes now that we've got these new opportunities to look at different ways of treating it. Now, you're not going to find any fluoride treatments in my practice, and I don't advocate swallowing or ingesting fluoride. Yes, there's research that indicates that it might have decreased decay rates in areas where the water's fluoridated, but there's also research that shows that decay rates went down in non-fluoridated areas, over the same period of time, and this is possibly because of an improvement in diet and oral health and oral hygiene at home. But in recent years, decay rates are starting to go up again as we're eating more processed food, we're exposed to more sugars and having more soft drink. But there's been some studies where it implicates ingesting fluoride to cancer, thyroid conditions and various bone problems, and that there's actually no real benefit to the teeth from swallowing fluoride. And swallowing fluoride in too high a concentration actually damages the developing enamel on the adult teeth, and this is called fluorosis. And look, personally, as a human being, I feel that fluoridating the public water supply is actually enforced medication of the public without consent. We don't know people's medical background. There isn't a set dose. It's dependent on how much water you are or aren't drinking as to how much fluoride you're getting. So to me, it's a very questionable practice, and I don't know, where we stand on that. To me, it just doesn't seem very ethical to medicate people without their permission. So some holistic dentists will advocate the use of topical fluoride. That's where you apply it onto the surface of the teeth or use it in your toothpaste. Now, some holistic dentists are dead against it. Now, in my opinion, that comes down to personal choice. Now, I personally prefer to use a non-fluoridated toothpaste because I grew up in a fluoridated area and I now also live in one. Brisbane added it to their water supply a few years ago. So I don't want to expose myself to something that I can't avoid very easily unless I have water filters or I drink filtered water or bottled water all the time. So I prefer not to have it. I'm very aware of not exposing myself to chemicals and toxins and pesticides because I want to be healthy. So in summary, what's the difference? Traditional dentistry could be seen as treating the symptoms of the teeth and gums and attempting to prevent those problems from recurring. So it's very reactive. You come in, you've got a problem, we deal with the problem, address the symptoms, but don't really ask why or work out what's underlying that may be causing it, and is there something there that we can change and address. Now, holistic dentistry, on the other hand, is going to focus on treating the underlying problems, the causes, the symptoms in the mouth, so as to eliminate those problems and prevent the symptoms are recurring. So we're going to look at diet, nutrition, lifestyle factors, toxins, etc. And we want to ensure that the work that we do in the mouth is not having any adverse effects or impacts on your overall health. So really, the true difference for me between holistic dentistry and traditional dentistry comes down to our philosophy and the approach to patient care, with one taking care of the teeth and gums, which is traditional, and the other applying a whole body approach. So if you're looking for more answers to your dental questions as to why you might be having issues, if you're looking for that more holistic approach and you're wanting someone who's going to support you in your health and well-being, perhaps a holistic dentist becomes part of your medical and care team. So I want to thank you very much for watching tonight's episode of Exposed Teeth. I'm Dr. Rachel Hall. I'm the principal dentist at Evolve Dental Healing in Brisbane. If you like what you see, then tune in. We're going to be here every other Tuesday. I'll announce it on our Facebook page, so check into Evolve Dental Healing, get the notifications, like the page. Thank you so much for watching. If you've got questions, pop them in the chat. If you'd like to reach out to me, if you want to book a consultation, our number is 0737201811. Thank you and good night.